Good evening and welcome to Nonsense Talk Live. Well, today I have a very serious issue to discuss with you. An issue which has actually raised serious concern among the people in the state. For those who are not aware of the situation, just a little recap of what has happened. Entire medical services going to go on stop on Wednesday for 12-hour strike. It so happened that the patient party at the Neil Ratan Sharkar Medical College or NRS in Kolkata had attacked an intern with a slab and injured him very badly, who is actually in a serious state. The entire incident is beyond condemnation, and this incident is not alien. Such incident had taken place earlier, and all the incidents have been condemned by all quarters. But holding the entire medical services hostage, closing down entire OPD is also not acceptable. First of all, I ask a big question to all the medical practitioners, doctors, would-be doctors, accepting their sentiments. Is it okay, is it fine to close down the medical services like this and turning a deaf ear, blind eye to the patients who actually come to you in serious state? Many patients may die tomorrow. Sounds harsh but true. Many patients who require immediate treatment will either be kept on the stretcher, because I have covered such strikes in my career and I have seen the pathetic condition of patients. I have also seen patients pleading the media, holding their feet to request the doctors, and I have also seen doctors begging mercy to us, media persons, saying that we are really helpless because it's union which controls. Well, as I said, the entire incident is beyond condemnation. If a patient dies, it doesn't mean that always the doctor is responsible, but at the same time, doctors too will have to take the responsibility, as in many cases. I can quote many instances. I can actually quote my own instance. When my father died on that Sunday morning, my family physician, I go on record, my family physician refused to come to house, said that he was enjoying his morning walk at Lodi Gardens with his friend, Delhi. I was helpless. There are many instances like this. So when such thing happens, I think it's also not advisable for the medical fraternity to take the patient party for granted, because we laymen always regard doctors, medical practitioners, even a junior doctor or the intern who is on duty at the middle of the night as gods. We look up to them for mercy. We look up to them in the helpless state. And they are no less than doctors. So when they behave like this, it hurts, it angers. Coming back to the story, perhaps this is the situation that's really asking for a president's rule in the state. Biggest surprise is Mamata, Banerjee, Chief Minister, also the Health Minister of the state, was at a public meeting at Vidyasagar College where she reinstated the bust of Ishwar Chandra Vidyasagar. She spoke politics, she discussed state politics, she challenged the center over the president rule. but she had no reaction over the ruckus that had taken place at the NRS and the situation that has become grave, compelling the doctors to go on strike. If the union of doctors call their boys, their family, then I think the health minister should also call the doctors her family members. Then why she is silent? Well, we really don't expect anything positive from her. One big question is, what will happen tomorrow to the patients who need immediate relief? What will happen to the patients who are admitted tomorrow with serious ailments? What will happen to the patients tomorrow who may die because of this strike call of the doctors? And finally, I want to ask, has our young doctors forgotten the oath of hypocrisy that they take while passing out? Holding the entire medical service hostage is not acceptable. It's inhuman. Perhaps this happens in this state because there is no proper hearing of such cases. Before summing up, I want to remind all of you about the Chief Minister, Health Minister, Mamata Banerjee, who convened a meeting of all the representatives from various hospitals after the ruckus took place like this at the Apollo. And we all, including myself, wrote in praise of her because she took the initiative, at least, to hear the plight and formulate a couple of policies. But today I was surprised to hear some of the representatives from the medical fraternity on various TV channels, segments, that these were mere pep talks, nothing has been done, and they blame squarely the administration for today's situation. I leave you with this question because this is no politics, this is no debate, but a very serious question. A question we all need to answer. Is holding the entire medical services hostage, closing down the OPDs, the only answer to the ruckus, to the violence that takes place after patient's death? Once again, I condemn what has happened. We all condemn. But at the same time, we cannot support the strike by doctors because helpless patients look up to them as gods. And many patients, I repeat, sounds harsh, but many patients will either die tomorrow or will get serious. And the onus squarely lies on these doctors.